Hello, hello, hello. Once again, this is Drew Shockley over at Move Health, and we are excited and pumped to start session number 3 of our Open Enrollment Summit. And session number 3 is a good one. So I'm glad that you're back. I'm glad that you decided to spend part of your afternoon with us over here. If you've been here, our first session was a great session with Christine Simone, one of the partners here at Move Health, formerly the founder and CEO of Caribou, which was an award-winning technology supporting financial advisors all over the country, and now a partner here at Move Health. You got to see her give an opening about why financial advisors should care about healthcare planning. If you came to the second session, you were with me talking about the Affordable Care Act and how premium tax credits work and all that stuff. And thankfully, hopefully, some of you decided to come back. If you're here for the third session, this session is CE eligible. So the name of the session, the title of the session is What Financial Advisors Need to Know About Medicare Open Enrollment. And it is CE credit eligible. So my friend Josie Living Good, everybody say, hey, Josie, the best last name in the world, by the way. That's her married name, so it's a really cool one. But Josie is my friend down in Dallas, Texas. You can say hello and wave to Josie in the chat. We can't see you, by the way, but any of you that are out there on the attendees, we can't see you, but you can see me. So you can say hello to Josie in the chat if you want to. She's going to be there throughout the entire session, answering questions, moderating any comments, providing helpful links. There's Beth again saying hello to Josie. And just that she just put some information in. That is true. Your maiden name was super cool. Raspberry. That's right. I knew that. But Josie's going to be here to help us throughout the entire session over the next, 45, 50 minutes or so to answer any questions you might have and to help me stay on task. So if you're here, there's a number of you still coming in and ready to join us. Health insurance is a major topic. Medicare is a major topic. And so we're going to spend some time talking about that today. I'm pumped and excited to do it. Outside of work, I actually have a family. I have a wife and I have kids. Her name is Jessica. These are my boys, Mason and Max. We spend a ton of time together on the soccer field or going to the lake or playing golf. That's our big thing. If you came to the first session, Christine Simone recently just picked up golf. I think it's the greatest sport in the world, but it's also the most challenging. So I love doing that with our boys. And I've been a part of 3 different healthcare startups over a 20-year career in the space. I started working for Anthem Blue Cross Blue Shield, which is a major insurance company. Now goes by the name Elevance, publicly traded, tons of, over, I think 40 or 50 million members, tens of thousands of employees. And I started there. And then I've also been a part of 3 successful healthcare startups over the last 17 years. One was a direct-to-consumer agency. One was a group-to-individual transition platform and a technology. And then now I'm one of the founders at Move Health, which is the premier healthcare and Medicare planning firm across the U.S. that works with financial advisors. So if you're here, I'm excited to dive into today's topic. And we've got 4 learning objectives for you today. Number 1, you're going to be able to accurately recall the dates and the timelines of open enrollment period for Medicare. Hopefully you can already do that, but if you can't, you're going to learn that in the session. Secondly, you're going to identify changes that are possible during the Medicare open enrollment period. We're going to clear up some things. What should clients do? Should drug plan, Medicare Advantage, MedSup, A, B, C, D? What do we do? I'm going to help you understand that in this session. Third, we're going to understand the financial impact of not reviewing insurance or specifically Medicare plans annually. And there are some, financial impacts. It's really, really important. And then lastly, we're going to identify planning opportunities for clients during the Medicare open enrollment period. So in order to do this, I want and need participation from you all. So please use the chat. Please feel free to ask questions. You can use the chat. You can use the Q&A box. If you're not familiar with Zoom, go ahead and familiarize yourself with that. Again, Josie will be watching the Q&A box. She'll be watching the chat, and I'll do my best as well. I've got several screens and monitors over here, but my focus is on you and topic number 1. So here we go. Learning objective number 1. What are some Medicare basics? What do we do? What are some timelines and other important information? And so we gave a pop quiz in the first session. I think we're going to do a pop quiz again. So if you missed the second session about Affordable Care Act, same question. What's the total U.S. population? Anybody in the chat? We're giving away a lot of points. You get something cool. You get the, there we go. Beth Agnello, I believe. Matt Licata, I don't know. I think both of you, 330 million. Beth, you're the winner. 500 points to you. Jordan, you're close. It's a little high, but the answer is 330 million people. Why does this matter? I don't know. It's just good to know some stats and data. And so we're going to talk about how healthcare is it's okay, Beth. It's you didn't cheat. You came to the other session, so it's good. Half of the population has healthcare coverage through their job. Okay, that's we know that. That's not hard to think. It's become a part of benefits in across the country today. Most insurance company or most companies that have 50 or more full-time equivalent employees offer some form of group health benefits. In fact, the Affordable Care Act requires people to do it. If you have 50 or more full-time employees, you have to offer health insurance or you get penalized. Companies that are under 50 don't. They don't have to do anything. They do. There a lot of times, people will do it as benefits, but if you're under 50, you don't have to offer group health insurance. Under group health insurance, kids can stay on their parents' plans until they're 26, and a lot of people, they stay until they're 65, and even people that are 65 and older that are still working, they could be covered by a group health insurance plan. So that's why 50% of the population, or 160, 70 million, whatever the number is, half the population's on group insurance through their job. Second group, over 14%, actually, a little bit higher now is covered by Medicare or utilizing Medicare. This is very specific to people 65 and above. Today, we're going to talk about MedSup, Med Advantage. We're going to talk about prescription plans. And we're going to talk about, people that are coming into this market, right? Like there are a lot of people aging into Medicare, and we're going to talk about it. We're diving in deep to it today. There is almost 20% of the population covered by Medicaid. So like Medicaid state programs. These are for low-income adults and kids. This is not really who we're talking about today. This is not, if you're a financial advisor, you're probably not working with people that are eligible for Medicaid. These are low-income state-based programs. These have been expanded by the Affordable Care Act over the last 15 years, but there is a big difference between Medicare and Medicaid. Fun fact, you can be eligible for Medicare and Medicaid at the same time. It's called dual eligibility. There are specific plans for people that are eligible for Medicare and Medicaid at the same time, but you can do that. The individual market, if you came to session number 2, like Beth did, you learned a lot about the Affordable Care Act, marketplace plans, federal, state, short-term sharing plans, stuff like that. But that's only around 6% of the population. So, it's not a large percent. And even still today, we have a number of people that are millions and millions of people that don't have insurance. People maybe with low incomes, maybe they don't qualify for Medicaid, but they, don't know how to get, health insurance through the market. Maybe they're a student between jobs. Maybe they're a gig worker. They don't really have a regular main full-time job. There's lots of reasons why people don't have insurance. But unfortunately, we still have a lot of people that are, that are uninsured. We're going to narrow down in the Medicare market today. And if you look at it, there actually are over 68 million people eligible for Medicare. That doesn't mean they're using it, but that's how many people are eligible for Medicare. And there are over 4 million people turning 65 this year. That trend continues, by the way, all the way through 2030. So there's like, 4 million a year, like 11,000 people a day that are turning 65 and becoming eligible for Medicare. And a lot of them have the same question. They're like, hey, I don't know how Medicare works. How does it work? I'm getting a bunch of stuff in the mail. What do I do? All of this stuff. So hopefully after this session is over, you're going to be a little bit more versed in how Medicare works, what clients need to do, what are some things to look out for. And hopefully at the end of the session, you'll find a lot of value. So to understand original Medicare, it can be broken down into 2 parts. Follow me on the right side of the screen first. Medicare Part A. This is your hospital coverage. This is inpatient hospital, skilled nursing, home health care, hospice care, stuff like that. This is Medicare Part A. Medicare Part B is medical, primarily doctors, outpatients, labs, tests, stuff like that is Medicare Part B. These are separate. Medicare Part A is generally $0. It doesn't cost you anything for those that have worked in at least 10 years or 40 quarters. Okay. If you were to go onto Medicare by itself, Medicare Part A, and have no other insurance, Medicare Part A has a hospital deductible of $1,676 in 2025. Fun fact, This is per benefit period. So it's not per year. Medicare defines a benefit period as a 60-day window after exit from a facility, whether it's hospital or skilled nursing. So if you go into the hospital, you pay $1,676. If you get out and 60 days passes, a new benefit period begins, and you could actually be responsible for that deductible again. Most people don't know that. Under Medicare Part A, they pay 100% for approved home health care services, 100% for hospice care services, unfortunate end-of-life care. Hospice is something that many, many people have to deal with aging parents, things like that. Super sad. But Medicare does, provide coverage for approved hospice care. Medicare will also help the first 20 days in a skilled nursing facility. So this is not like, Uncle Johnny is just old and we need to put him in a nursing home. That's not what a skilled nursing facility is. This is a skilled nursing facility is typically after an event or after something has happened. You go to the hospital, heart attack, stroke, something happened. You're not really able to go home, but you don't really need to be inpatient in the hospital. This is where skilled nursing facility comes in. Medicare pays for the first 20 days, just shy of 3 weeks in a skilled nursing facility. And then generally, if you're on Medicare Part A alone and you don't have anything else, you have to cover day 21 through 100, yourself, and you spend, $200 a day. Medicare Part B. Medicare Part B has a monthly cost to it. The standard cost today is $185 a month. That's the Medicare Part B premium today. Most of you that are on here, and understand what that acronym is there, IRMAA. It's individual Medicare related income related monthly Medicare adjustment, or a monthly adjusted amount. It's something to do with people's income and how it can impact the cost of Medicare Part B. We're going to show you that in just a minute. Medicare Part B, if you had no other insurance, you would have a deductible of $257. And that deductible is actually just once per year. Unlike Medicare Part A's deductible, which is per benefit period, under Medicare Part B, it's one time per calendar year. And then after that, generally, Medicare pays 80%. That's literally what the guidelines say. Medicare generally pays 80%. And then the client generally would pay 20% for Medicare eligible expenses. The problem with this is, hey, 257 deductible, 80/20 coverage sounds great. But with Medicare Part B, there's no annual cap. So if you have Medicare Part B alone and you don't have anything else, you have to pay 20% of every bill. We don't like that. We don't recommend that. Chemotherapy, radiation, stuff like that. If you go in and it's $10,000 of, a treatment, you'd have to pay $2,000. And if you go twice a week for 6 weeks, that adds up really quick. We don't want to put clients in a position where they're on Medicare A and B alone. In fact, very few people just have Medicare A and B alone with no other insurance. Side note, quick bonus learning. We're going to learn a little bit more about IRMAA. I mentioned it on the previous slide, but IRMAA is income-related monthly adjusted amount, and it's an increase to your Medicare Part B and Part D monthly premiums based on your modified adjusted gross income from 2 years ago. Most of you probably know this, but there's a chart over on the right. In 2025, you're paying an IRMAA increase based on your 2023 income, modified adjusted gross income. If you're single, and you file an individual return, and in 2023 you made less than $106,000, no big deal. You pay the standard premium of $185. If you make between 106 and 133, 259, 133, 167, you get the point. The top tier, so there's if you see it, there's 1, 2, 3, 4, 5 tiers of IRMAA adjustment. The top tier starts at $500,000 for a single person, or $750,000 for somebody filing a joint return, married. Okay, so $750K of Magi, 5 years, or is tier 5 IRMAA. That's the 185 plus the adjustment is $628, plus you pay $85 on your Medicare Part D premium. Most of you know this, and you can help clients prepare for it. You can, appeal stuff in particular situations. If somebody had like a peak year, they sold a business, something happened, you can appeal that, but it does fall off as your income reduces, in future years. So anyway, fun fact, bonus learning on IRMAA. There you go. With Medicare A and B, generally, there are 2 types of products. Generally, you can look at a traditional Medicare supplement, or a Medigap plan, or a Medicare Advantage. Really, there are only 2 routes you can go to improve your Medicare coverage. We're going to focus on MedSup first. We're going to talk about Medicare Advantage, and then we're going to compare both. Okay. Traditional Medicare supplements, they've been around for a long time. They're not new. They've been around for quite some time. They've changed a lot over the years. But if you enroll in a traditional Medicare supplement or a Medigap plan, Medicare A and B are your primary. So just what we went through there, A, B, primary. You get your red, white, and blue card, you go to the doctor, you give them that first. If you want to enroll in a Med Sup, we go out to an insurance company and we choose an insurance company to be secondary, right? So when you go to the doctor, you use both. Most people don't understand this or realize this, but if your doctor accepts Medicare, they will accept your Medicare supplement. They have to. So if you're on a traditional Medicare supplement, Medicare's network of doctors and hospitals, that's what wins because they're primary. It doesn't matter what insurance company you have as your secondary for your Med Sup. Okay. Very, very important because this is not how it works on other products. But with Medicare supplement plans, this is how it works. The cool thing about Med Sups is they come in and they do lots of things. I'm going to show you in a second. But most Medicare supplements actually pay excess charges even if the doctor doesn't accept Medicare assignment. What that means is that basically they say, hey, I'm not in Medicare's network. We don't accept Medicare's, pay scale for treatment. If you have a Med Sup, you get excess charges. That's not how it works in a lot of other products. So the two most common Medicare supplements are Plan F and Plan G. Plan F and Plan G. Plan F is a really great plan. It's been around for a long time. A lot of clients may have Plan F if they've been in Medicare for a while. Medicare Plan F, Medicare Supplement Plan F, pays for the Part A deductible and the Part B deductible. It pays for days 21 through 100 in a skilled nursing facility. It pays for the excess, like I mentioned on the left side. It pays for the first 3 pints of blood. Okay, kind of weird, but Medicare doesn't pay for the first 3 pints of blood. Medicare Supplement Plan F does. It pays for the hospice care coinsurance and foreign travel up to $50,000. Plan G, for comparison purposes, Plan G pays for the Part A deductible only. It pays for days 21 through 100 in a skilled nursing facility, Part B excess, 3 pints of blood, foreign travel, or hospice and foreign travel. Why? What's the difference? Well, Plan F is actually no longer available through the Medicare Access and Reauthorization Act, the MACRA, which came out in 2015. Medicare Supplement Plan F was limited. If you're eligible for Medicare, your client is eligible for Medicare after January 1, 2020, they can't have F. It's just not possible. So only if you have some older clients, they need to be like 70 and beyond, they might have Plan F. But most clients these days are enrolling in Plan G. That is our primary plan. That's the primary plan we use for a Medicare supplement perspective. And that's what you will see. Later on, we're going to talk about moving from one plan to another. If you have clients that are on Plan F, just a side note, you can save them a lot of money by having them move from Plan F to Plan G. And in many cases, they won't have to do anything. They can make that change. And here, our team at Move Health, we do that all the time. But a lot of clients can move from F to G, and it's a great opportunity for them to reduce some costs. So that's traditional Medicare supplement. That's a very, very common option, and it has been for many, many years. The second option is a Medicare Advantage plan. Medicare Advantage plans are also known as Medicare Part C. These came out in 2006. Actually, I was brand new to the industry. I was in my second year, and Medicare Advantage plans were coming out. I was like, what in the world are these things? Nobody really knew what they were back then, but they've grown significantly. We've watched the Medicare Advantage, product change and evolve over the years. So here's some things you need to know about Medicare Advantage or Medicare Part C. Typically, what happens with a Medicare Advantage plan is it combines Medicare Part A, your hospital, Medicare Part B, and your prescription drug coverage. In many cases, Medicare Advantage plans actually have low or no monthly premium. Kind of interesting. Deductibles and copays are set by insurance companies, and they may offer additional benefits like dental, vision, stuff like that. You cannot have a Medicare Advantage plan and a Medicare supplement at the same time. It doesn't work like that. Because what happens if you enroll in a Medicare Advantage plan, you choose an insurance company to become your primary and to take over for Medicare. So if you're in a Medicare Advantage plan, you have to be enrolled in Medicare A and B, but Medicare A and B don't pay doctors. They actually pay the insurance companies to take over managing your health insurance cost, your healthcare cost for hospital, doctor, and drug coverage. Fun side research project. If you want to, burn some time later this afternoon, look up the topic, Medicare capitation payments. Really super fun. It'll show you how much money the federal government pays to insurance companies when somebody enrolls in a Medicare Advantage plan. Just to save you some time, insurance companies get paid about $10,000 or more for every person that enrolls in a Medicare Advantage plan each year. So this is how they can offer coverage that has low or no monthly premiums, okay? When you do this, unlike original Medicare, you are choosing an insurance company to become your primary. And typically, it includes a network of providers. So a lot of Medicare Advantage plans are HMOs. If you go into an HMO plan, you have to use network providers. Maybe referrals are required. Again, this is attractive for a lot of people because it has low or no monthly premium. The second type of product is a PPO. So, right, just pretty standard insurance stuff. You might have an HMO or PPO. Typically with that, PPO plan is, no referrals required. You get your choice of providers. You could still have low deductibles, low premium, stuff like that. But Medicare Advantage is different. If you go with a Medicare Advantage plan, your client goes with a Medicare Advantage plan, it is choosing an insurance company to take things over. You still pay your Medicare. You still have to be enrolled in Medicare A and B, pay your Medicare Part B premium, but whatever carrier you choose, they become your primary, and they're paying doctors, hospitals, they're managing all your benefits, paying claims, going through network, and it works. Medicare is not doing that. So Medicare Advantage plans, very specific. How do you choose? How do you know what's right? What's right? What's wrong? Or are Medicare Advantage plans bad? Or Medicare? The answer is no. Like both of them are fine options. But I'm going to talk a little bit more about how some people choose one over the other. And actually, I just see a question that popped up. So Nicole says, how is Supplement G helpful on the no cap issue for Part B 20% responsibility? How covered with a Medigap plan such that those for Part B coinsurances? Okay, great question, Nicole. I think what you're answering, I'm going to go back and answer this really quick. So Plan G, it pays for the 20%. It pays for the 20%. So it pays for all of the Part B excess charges. So Medicare Part B will cover 80%. Plan G covers the 20%. A client will have no out-of-pocket responsibility for Medicare covered services. Plan G is the bomb. It's the best. We love Plan G. That's what we're using for the vast majority of our clients. There are a few other Medicare supplement plans, but Plan G is the go-to. Great question, Nicole. Thank you. Keep them coming. I'm happy to go back and answer them live. So what do we choose? How do you know which one to choose? Whether you're going to get a Medigap or you're going to get a Medicare Advantage? How do you know, right? Like those are the two options. Well, if you go with a Medigap or traditional Medicare supplement, then you've got that, and you typically buy a separate prescription drug plan. Typically, this has a monthly premium, but usually no copays. You don't have to pay anything out of pocket except for maybe your deductible, right? If you're in Medicare A, B, and a traditional Medicare supplement plan G, once they pay the $257, they virtually pay nothing out of pocket for all covered Medicare expenses. You can't beat it. You got the freedom to choose doctors that you want. You got the Medicare networks. You can go out of state. You can travel. You can do this, that. Traditional Medicare supplement gives you the freedom and flexibility to be able to do that. No referrals. You don't have to do that. You can get coverage anywhere where Medicare is accepted, right? So if you live in, Minnesota, but you spend the winters in Arizona, no big deal. That is a problem when it comes to Medicare Advantage plans, okay? Medicare Advantage plans typically have no, low or no monthly premium, but you do pay out of pocket when you use it. Sometimes Medicare Advantage plans have $3,000 out of pockets, $4,000, $5,000, $6,000, whatever. It depends on the state you live in, but maybe you pay low or no monthly premium, but you have out of pocket when you use it. Another thing with Medicare Advantage is you're restricted to specific networks, HMO, PPO, things like that. You may have to have a referral to see a specialist. Emergency, if you're outside of your network, you may only have coverage for emergency services. So the example I gave a moment ago, if you live in Minnesota, but you spend 3 months in Arizona, you may not have coverage in that particular state with a Medicare Advantage plan, only for emergency services only. So, with Medicare Advantage, some plans, may include drug coverage as well as dental vision, things like that. So there's a lot to consider. Okay. So, how does it differ? What does enrollment actually look like? And what percentage of people are in a Medicare supplement, Medicare Advantage? I'm going to answer that question. So it kind of depends on the state. Okay. If you see your state out here, some states have a pretty high penetration for Medicare supplement. If you live in, Oklahoma or Nebraska, for instance, there's 60+% of people. If you live in Iowa, 67% of people are on a traditional Medicare supplement. Texas, for instance, 42%. Arizona, 47%, right? You have states like Florida, California, other states where have a high number of retirees. You'll see that the Medicare supplement or traditional Medigap percentages actually reduce. Here, kind of in the Midwest or in kind of the heartland, you got 50+% of people traditionally have a Medicare supplement or Medigap plan. When you get toward more cities and more like bigger cities especially, and more where there's bigger networks, Medicare Advantage plans have grown significantly. And in fact, since implementation of Medicare Advantage, we've seen a pretty high scaling membership into Medicare Advantage. Now, these are some national statistics. Now, over 54% of Medicare eligibles are enrolled in Medicare Advantage. Okay. A lot of that has to do with population. If you look back and, kind of look at this, I mean, you've got a lot of people, high percentage of people in some of these states that have traditional med subs. But when you look at the total Medicare membership, it's about 50-50. About half people have Med Advantage and half the people have traditional Medicare supplements. Most Medicare Advantage membership is actually consolidated into 2 or 3 companies. United Healthcare, largest. They got like 10 million. Humana, very popular one. Your client probably has told you before, I have a Humana HMO, right? That's a Medicare Advantage plan. So there's about, they got about 6 million people or so. This is as of 25. And these are the total number of people in a Medicare Advantage and the carriers that are being used. Okay. David Irwin, he sent an amazing question in the chat. He said, hey, can tell us about the enrollment periods and those types of things. David, this slide is for you, my friend. So here are some key dates. The Medicare Open Enrollment period is October the 15th through December 7th. Okay. This is when you can review prescription drug plans. You can review Medicare Advantage plans, October 15th through December 7th. Whatever plan you choose or whatever you enroll in, is eligible, or it starts January the 1st. You also have an additional period. This is specific to Medicare Advantage called the MAOEP. A lot of acronyms here, but this is specifically to Medicare Advantage, and it gives enrollees a second chance to make a change or to optimize their healthcare coverage. This happens in January, February, and March. Okay, so if you get into a Medicare Advantage plan or you miss a Medicare, you choose one and it's not the right fit for you, then you can actually change your Medicare Advantage plan January, February, March. Kind of interesting. We've only had that for the past couple of years. This is for existing people that are in Medicare. Okay. You also have special enrollment periods for people all the time. These are triggered by specific events. Somebody is maybe eligible for Medicare and they lose, they're working and they lose employer coverage. Well, they can, utilize a special enrollment period. If you move from one state to another, say you're living, same, example of in Minnesota, you moved to Arizona, or you moved from Arizona to Florida or whatever. If you're moving states, that's a special enrollment window. But these are for existing people into Medicare that are utilizing it today. What about for a new beneficiary? What about for new people? Well, this is called the initial enrollment period. This is typically a 7-month window, 3 months before somebody turns 65, the month of, and 3 months after. Okay, this is when you have to make a decision whether you're going to do it or not, whether you're going to enroll in Medicare or not. Not everybody does that. We're going to talk about that in a second. If somebody's 65 and they're eligible for Medicare, but they're still working, we're going to talk about that. But typically the IEP, or the initial enrollment period, is 3 months before, the month of, and 3 months after. If you miss this, you got penalties for that. So you don't want to do that. Most people don't. And really the more important aspect is the penalties are not that severe. It's 10% for every year you didn't enroll. It does matter. But really the more important thing here, when somebody is turning 65, and this is what I want to pause and provide some emphasis on. This may be the only time that your client has the ability to enroll in a traditional Medicare supplement without going through medical underwriting. This typically is tied to either turning 65 or the Medicare Part B start date. This is super important, ultra important, especially for clients that may have any chronic or ongoing medical conditions. Okay. Enrolling in Medicare is good, right? You get it, A, B, whatever. That's easy. But it's really, really super important that people don't miss this Medicare supplement guaranteed issue period. Okay. We tell clients about it all the time. I don't know. I kind of, for many years, I've kind of called it the golden ticket. This is like the time where you can go and pick whatever Medicare supplement plan you want. Plan G with any company. This is how it works. You can get that for free. No questions asked. You sign up, you get the best deal possible. They cover everything right away. This only happens in conjunction with your 65th birthday or your Medicare Part B start date. Ultra important. Okay. Josie is drawing attention to a question in the chat. Beth Agnello. I don't know if I'm saying that right or not, but Beth, you're amazing. This is a great question. Did I hear you correct to say that the federal government pays the Medicare Advantage insurance company $10,000 when somebody enrolls? Beth, yes, you heard correct. This is called Medicare capitation payments. The federal government paying an insurance company to become the manager of their healthcare benefits. When somebody enrolls in Medicare Advantage, Medicare takes the money they had set aside, they pay it to the insurance company, and the insurance company takes over. So if your client's in a Medicare Advantage plan and they're asking you questions like, hey, why is this plan $0? Why are they telling me on TV that it doesn't cost anything? Why is my friend on Humana and it's $0? Well, that's because of the Medicare capitation payment. Really fun, interesting research project later on. They paid them a lot of money each year. This is how insurance companies can do this and offer plans for $0. Great question. Keep the questions coming, Beth, or anybody else that's out there. Keep the questions coming. So not everybody enrolls in Medicare when they're eligible. Okay. Sometimes people keep working. So if you have a client that's going to keep working after the age of 65, this is what you need to do. If your client continues to work beyond 65 at a job with at least 20 employees, this is easy, that provides health insurance, or this is important, that provides health insurance and credible drug coverage, you can hold off enrolling into Medicare. Okay. The client does need to actively defer Part B. That is my professional recommendation. If they're actively working at a job that has at least 20 employees, this means that the health insurance that's available, as long as it's credible, can be used and it can be primary. But the client should defer Part B. Why should they defer Part B? Well, it kind of goes back to the point I was making a moment ago. If they don't defer Part B, they could miss out on that guaranteed issue period with a Medicare supplement plan if they enroll in Part B at 65, but they keep working. Okay, let me just say, they turn 65, they work for 3 more years, they come off at 68. They may not be able to enroll in a traditional Medicare supplement with no questions, dependent upon their Part B start date. So if somebody's actively working, they should defer Part B, in my opinion, if the company has 20 more employees. If your client's receiving Social Security benefits for at least 3 months prior to their 65th birthday, maybe they were disabled, something happened, they will automatically be enrolled in Medicare Part A and B. Great question. I'm seeing something, David. I'll go back and answer that one right now. So what is actively defer Part B? So David, if your client is paid into Medicare through their paycheck for 10 years or 40 quarters and they become eligible at 65, Medicare is going to send them information about enrolling into Medicare A and B. If the client is working, this is specifically if they're working at a company that has 20 or more employees, they need to tell Medicare that they're going to not need Medicare Part B for a period of time, right? They're going to tell them they're going to keep working and they have insurance through their job. This is what actively defer Part B means. If you have a client that's actively working and they work at a company with 20 or more employees and they're going to keep doing it for a while, then you should actively defer Part B because they don't really need it. If they have health insurance through a job, they don't need it. They should wait and put their Part B in place whenever they're going to utilize it at a later date, whether that's 67 or 68 or 72 or whatever that might be. Deferring Part B not only reduces cost for something that they don't need, it's redundant if they have quality or qualified insurance through an employer, but it also saves that time for them to transition into Medicare and get a Medicare supplement with no questions. Okay, very, very important. Great questions coming in. Colleen says, does this apply to spouses who turn 65 of people actively working? Great question, Colleen. I love that you brought that up. I think that if somebody is actively working as the employee, they most likely should keep using the coverage through the employer if they have 20 or more employees. This is not the same for a spouse, in my opinion. My professional opinion is if that a spouse is on an employer-sponsored plan, they should definitely review, and they're turning 65, they should definitely review the opportunity to enroll in Medicare A and B and get a supplement or a Medicare Advantage plan. I recommend that every time if they're not the active employee. If they're the spouse, they probably will be able to do better utilizing Medicare A, B, and a Med Sup and drug coverage compared to what they would have on the group insurance through the job. This is I know this is something y'all deal with all the time. So if it's an active employee and they have health insurance and they're becoming eligible for Medicare, but they're going to keep working, they probably just need to defer Part B. If it's a spouse, I recommend that they look into utilizing Medicare and figure out whether they want a Med Sup or Med Advantage if they're becoming 65. In many cases, they're spending $700,000, $800,000, $900,000 a month for that spouse that's 65 to be on their plan if they're not working there. So most cases, you can do way better moving them in Medicare A and B, getting a Med Sup and a drug coverage. You can probably cut their costs in half and make their coverage better. Okay, great question. Travis Allen says, I have a client that's working for a firm with less than 20 employees. They turned 65 in October. Their HR team is saying that their coverage is credible. What type of information should we collect to verify that this is the case? Great question, Travis. The 20 employee threshold has to do with who's primary. If you work at a company with more than 20 employees, that employer group health plan becomes primary and Medicare secondary. If the company they work for, so I don't know the answer here, firm, or whether it's a part of a larger conglomerate, if it's a large, if they have more than 20 employees as a whole, as an organization, then that group plan would be primary. But you just need to double check to make sure that it's credible, because you don't want them to face any penalties for not enrolling in Medicare. If actually the full company has less than 20 employees, then Medicare would actually be primary. This is kind of a touchy situation. So I would recommend, if you're working with us, Travis, I'm not sure if you're already working with Move Health, but reaching out to one of our advisors and asking that question, and we'll be happy to take it offline as well. Okay. So this is a great topic. I'm glad we put this slide in here. What if my client's working past 65? If they're the active employee, they should probably defer Medicare Part B. If they're the spouse, they should probably use Medicare. That's my professional opinion. If your client is reviewing Social Security or they're receiving Social Security, they're going to be automatically enrolled anyway. Big one, number 3, COBRA is not considered credible. Okay. So if you have a client that's eligible for Medicare and they're 65 and they have COBRA, it's not credible. You don't want to do that. Really important. They could be penalized. They could miss out on particular enrollment periods, maybe the guaranteed issue period for Med Sup. You don't want to do that. If they have COBRA, tell them, hey, you got to get off there, and you can't do it. And then lastly, if your client's over 65, they gotta stop HSA contributions. But most of you all know that, so it's pretty straightforward. Great engagement here. Beth says, hey, that's a big number when it comes to the Medicare capitation payments. Yeah, it's 10,000. I think it's actually a little bit more than that in most states, but it's 10,000 plus. DD Jones says, what is your take on rollout of AI review of pre-authorization for traditional Medicare? Great question, DD. I am, when it comes to, AI in anything, I think that, my belief is it's great to provide a guide. It's great to provide, information, but really human interaction. We can't replace human interaction, especially on something that's super touchy as healthcare and topics. And so, we are implementing this inside of Move, and we're using various things, but we also, every single, client that comes through our platform gets human engagement. So, great questions here. Great comments. Let's keep them going as we move into objective number 2. Objective number 2 is, how do you guide clients through Medicare Open Enrollment? Like, what do you have to do? Like, what can clients do? What can they do? How do you optimize this time? Like, other things that we should be aware of. We're going to go through this. There's a lot to it. So here are actions that clients can take in open enrollment. Remember, the Medicare Open Enrollment, or AEP, is October 15th through December 7th. This is for people that are actively in Medicare. Okay. If clients are in a Medicare, Advantage, or they're in, original Medicare, they can enroll in a Medicare Advantage plan for the first time. That's an option. They can also do the opposite. They can move from Medicare Advantage to original Medicare, and they can apply for a Medigap plan or traditional Medicare supplements. We're going to talk about that in a second. There's several slides about this. It's important. We'll come back to it. They can switch to another Medicare Advantage plan. So if they're on Medicare Advantage now, they can switch to another Medicare Advantage. They can enroll in, switch, or drop a Part D prescription plan. Anything that they do in this period takes effect January 1. Okay. This is important. If your client has a traditional Medicare supplement plan, this period of time doesn't have anything to do with traditional Medicare supplements. Okay. Traditional Medicare supplement or Medigap plans are not subject to this window. October 15th through December 7th is only for Medicare Advantage and prescription plans. Okay. MedSups, there's no enrollment period. We're going to talk about how this works, but there's no enrollment period, and you can review, Medicare supplement or Medigap plans at any time. This period of time is specifically for Medicare Advantage and drug plans. So as we kind of take a deeper look about what people can do during this period, they can review changes in their current coverage, right? So they need, if they're in a Medicare Advantage, especially in a Medicare Advantage, they need to confirm that their doctors, hospitals, and pharmacies are still in network. They need to check and see if their prescription drugs are covered under their plan's formulary. They need to compare total cost. Okay. So like not just premiums, deductibles, and copays, but they got to put everything together, right? And make a decision. If they're on a Medicare Advantage, they can evaluate extra benefits. So like, dental, vision, hearing, stuff like that, and more. They can consider traditional Medicare supplement options if, they're moving away from Medicare Advantage plan. However, they're likely subject to underwriting. This is really important. So Beth, great question. Beth sent a question in. She said, so at any time, can a person review the provider of their Plan G Medicare supplement? And if they pass medical questionnaire, can they change insurers? Beth, what a wonderful question. I'm literally about to talk about that for the next several minutes because yes, the answer is you can change your Medicare supplement plan at any time. And in fact, Medicare Supplement Plan G is a standardized plan. So every insurance company that offers a Medicare supplement, it has to have the same benefits. People can review their Medicare supplement plan anytime, but it's not, it's tricky at times. A moment ago, I talked about how when you become eligible for Medicare for the first time, or you're turning 65 or getting your Medicare Part B, there's a 6-month window where you can sign up for Plan G with no questions. Okay. If you're outside of that window, this is how it works. If you want to move from a Medicare Advantage, you have a client that wants to move from Medicare Advantage to a traditional Medicare supplement, this is how it works. Step 1, you got to figure out when you can get out of a Medicare Advantage plan, okay? You can only leave Medicare Advantage plans during specific periods. You can leave October 15th through December 7th, January, February, March, or an SEP. When you go back to original Medicare, when you drop a Medicare Advantage plan, you're automatically placed back into Medicare A and B as your primary coverage. At that time, you can actually pick up a prescription drug plan, and then you can apply for a Medicare supplement. This is tricky. I mentioned it a moment ago. I'm going to say it again. There's only that 6-month window when you turn 65 or when you enroll in Medicare Part B. During that window, there's no questions. It's guaranteed issue, no medical underwriting, no denials, no higher premiums for pre-existing condition, blah, blah, blah. It's your golden ticket. When you only get that when you're 65 or when you get Medicare Part B. After that window, you got to go through underwriting. I know if you came to the session earlier about the Affordable Care Act, it talked about how plans were guaranteed issue. Well, Medicare supplement plans are not in most states. Carriers can still deny people coverage, charge higher premiums, or exclude pre-existing. They can do all the things. So it gets really tricky when you want to move from a Med Advantage to a Medicare supplement, or you want to move from one Medicare supplement carrier to another Medicare supplement carrier. If you're getting out of a Medicare Advantage, you can only do that during certain periods. But if you're already in a MedSup, you can change to another Medicare supplement carrier. You just have to go through underwriting in most states. As I said before, this is not the case for all states, okay? There's some unique rules. Here are a couple states that have some guaranteed issue or some strong protections for Medicare beneficiaries. Connecticut and New York, there's a guaranteed issue period year-round. If you're greater than 65, you can make a change to your MedSup to another carrier, and it's guaranteed issue. Connecticut and New York, by the way, are some of the highest costs for Medicare supplements across the board because they have this period. Massachusetts also has a very state-specific enrollment window for MedSups. February, March of each year, you can make a change. Maine allows like 1 month a year for Medicare supplement guaranteed issue period for you to get Medicare supplement plan A. That's not Medicare Part A. It's Medicare supplement plan A. Okay. So hang with me. There are some other rules, some other states that allow birthday rules. See the birthday cake thingy? Trying to tie it together. There are certain birthday rules, okay, which allow an automatic switch from one Medicare supplement plan to another Medicare supplement plan with equal or lesser benefits. These states, California, Oregon, Idaho, Illinois, Louisiana, Maryland, Nevada, Oklahoma, Kentucky, Utah, Virginia, and a new rule in Indiana allows for some switches, okay? So you can change Medicare supplement plans, or you can change from a Medicare Advantage plan to a Medicare supplement plan, but it's tricky. Nicole, I'm gonna read your question live. Why would you want to switch from one MedSup carrier to another MedSup carrier? Do the benefits differ on the carrier for the Medigap plan? Great question. Benefits are the same. They're the same. Plan G is Plan G is Plan G is Plan G. Whether you have Mutual of Omaha or Blue Cross Blue Shield or United Healthcare, AARP, or Mickey Mouse Insurance Company, it doesn't matter. Plan G is Plan G. But Medicare supplement plans, specifically Medicare supplement plans, are kind of like gas stations. It's the same product, but it's a different price, okay? So you might want to switch to a different insurance company because they offer a more competitive premium for the Medicare supplement plan that you want. Plan G with one insurance company might be $125 a month, and Plan G with another insurance company might be $175 a month. Your client needs to work with an agent to appropriately make that choice and decision, and hopefully be in a carrier that can sustain rates over a long period of time. It is not uncommon for us to find clients that are in a Medicare supplement plan that they bought 10 years ago that has increased costs so much, and then we can actually cut their cost in half by moving them to the same plan with a different insurance company. They don't lose anything. So really, really great question. Why would you want to switch? Purely cost. I mean, it's premium. Again, traditional med subs are like gas stations. You can find the same product somewhere else for a little bit less. So really, really great question. All right. Last one. This is super, super important. If you have a client that has moved to a Medicare Advantage plan and they did it for the first time, maybe their friend did it, or, they went to a meeting and somebody signed them up, or in, some cases, maybe they had somebody knock on the door and sign them up for a Medicare Advantage plan. And they come in your office and say, hey, Nicole, or Travis or whatever, I got this Medicare Advantage plan. I don't know. I called some number and I'm in it, but I don't like it. Okay. There is they allow a one-time switch under federal law. It's called Medicare Advantage trial rights. If somebody joins a Medicare Advantage plan, and within the first 12 months, they decide that they want to leave it, they can do so. And they can go back to original Medicare and a Medigap plan. They can do this one time. It's complex, but it's possible. And so this is why you would want to work with, an expert. This is why you would want to work with somebody, have a good relationship with a firm to help people navigate this, because the costs are pretty high. In fact, that's learning objective number 3. Josie, just checking in, just waving to you. Josie's doing amazing in the chat and all this stuff. She's sending me great notes. She's telling me the time. She's doing incredible stuff. So learning objective number 3, the financial impacts of not reviewing coverage could be high, right? Drug costs could skyrocket. If they have prescription drugs that are on the formulary today, and then they're not on the formulary later, this is a problem. We don't want that to happen. Networks, doctors, hospitals, pharmacies, they may leave in a Medicare Advantage plan each year. They change. So you got to do that. People miss out on benefits, right? So Medicare Advantage plans often add or remove benefits, dental, vision, hearing, stuff like that. And premium and out of pocket, right? This is a big deal. Same old. A lot of times, the risk of not reviewing something annually is when a client chooses a plan, but they don't understand the risk. The most common thing we see is people get in a Medicare Advantage plan. They don't know what it is, and they want to go back to a med sup. How do you do that? Well, there's ways to do it. It's tricky, but you need to work with an expert. How do you optimize coverage during this period? Well, you got to review network, especially if it's Medicare Advantage plan. Switching from one to another could save them thousands of dollars. Maximum out of pocket, HMO to PPO, that kind of stuff. Maximum out of pocket is a big deal for Medicare Advantage. Plans change every year. Some carriers exit, some new ones enter, and it's an annual thing. It's crazy. You kind of never know what's available until it comes out. Okay. Part D plans have become significantly easier in the past few years. In fact, Part D plans have an out-of-pocket maximum of $2,100 for 2026 for covered prescription drugs. This is important. It's vitally important that prescription drugs, the client needs to check their drug plan to make sure that drugs are covered on their plan so that they can hit that $2,100 cap. If they don't, it's higher than that. It won't be capped at 2,100, but if it is, the federal government says there's rules, and 2,100 is the max, but only if it's covered on the formulary. Okay. A few other tips, like start the conversation earlier. September is the right time. You got to do it before clients get overwhelmed, because they get a bunch of mail, they get a bunch of commercials, you flip through the TV, and it's everywhere. I probably recommend segmenting your client list, right? So like you've got people that are 64, they're preparing for Medicare, they're dealing with certain things. Then you got people that are kind of navigating Medicare in the first few years. So they're between 65 and 70, and they're trying to figure it out. Hey, I got this plan, I got that plan, I got a Medigap plan, I got Plan G, I love it, but it went up, $50, a year, whatever. Should I do it? Should I not do it? I got this friend that says they're on Humana and it's $0. Should I do that? Like, they're in their first 5 years, they're trying to figure things out. And then you kind of got people that are 70 and beyond, and they're just kind of optimizing, right? Especially if they have a Med Sup, Plan G, they kind of just set it and let it ride. And then they just kind of need to review their drugs. But you should take some notes. You should segment clients, take some notes, figure out what they're doing, encourage them to do annual checkups with an agent. Even if they're happy, tell them to talk to an agent. If it's Move Health, tell them to talk to us. Educate them on stuff. Tell them they got to, be in Part D. If they're, if there's somebody early on, tell them they got to, they got to enroll in Medicare. You don't want to miss out on this. Tell them about the Medicare supplement guaranteed issue period. You got to tell them this. They will love you for it. I promise you. You're going to build trust. You're going to build deeper relationships. If you tell them these tiny little tricks, you don't have to do it. You don't have to be the expert. You don't have to implement the solution and enroll people in Med Sup. We can do that, or you can find a partner, that can do it as well. But this is what we do at Move Health, is help people optimize these things. And we work in conjunction with financial advisors. So what are the takeaways? Annual Medicare reviews aren't just about healthcare, really. They're about protecting income, minimizing tax burdens, and really ensuring the peace of mind. If you do this, financial advisors who guide clients through, they demonstrate measurable value and strengthen long-term relationships. I mean, there's nothing better. We know clients are coming to you for healthcare stuff. We know it. And you don't need to be the expert. It's hard. There's a lot to do. You're sitting here, you've been on, this with me for, 30, 40 minutes or whatever. There's a lot to it. And so you got to leave it to somebody who does it every day. And that's what we do over here. So here we go. Last learning objective, number 4. How do we identify opportunities? What should we be listening for? What do we do in our CRM? What are some keywords? What about some other tips? All these things, we're going to give it to you. We're wrapping up the end. Write your questions down, put them in the box, do whatever. This recording will be made available, and we're so thankful that you all came. We'll wrap it up with this last learning objective here. So here's some things. I'm turning 65 soon, right? Obviously, Medicare. My spouse is retiring or turning 65. This is pretty important, right? I mentioned it earlier. If somebody's actively working, they should probably keep the coverage that they have if they're the employee. If they're the spouse, we recommend taking them off. Getting the Medicare and utilizing a Med Sup or drug plan is probably better. 99 times out of 100, it's better to move that spouse onto Medicare and use coverage. I just got divorced, or I just got remarried. That's important. I'm eligible for Medicare, but I'm still working, right? We went through that, answered some questions there. My premiums are going up, right? Obviously, these are easy. We can't afford this coverage anymore. I'm confused. I don't know what I don't know what an HMO is, PPO. I don't know what all these things are. I just keep getting stuff in the mail, and I just don't know. I'm worried about my out-of-pocket costs. That's a big deal. And we hear this mostly from a Medicare Advantage perspective. There's something called an ANOC. It's an annual notice of change. Clients get this thing. It's a big, thick thing. If they're on a Medicare Advantage plan, it tells them all the changes that happen. Most Medicare Advantage plans have anywhere from a $3,000 to a $7,000 out of pocket. So people kind of see that, and then they're like, "Oh, I'm worried about it. I don't know how my Medicare Advantage plan works. I just know I have this, $6,000 or $7,000 out of pocket. What do I do?" Well, these are some keywords and some triggers where you could say, "Hey, this is an opportunity for me to help." If you have a CRM, hopefully you do. These are some things you can do. Tag some key events like retirement dates, turning 65. Somebody becomes disabled. You can be on Medicare if you become disabled and you've been there for 2 years. Medicare eligibility starts 24 months after the disability onset. Losing employer coverage, stuff like that. Set reminders to track birthdays. 64 and a half, We would love to talk to every 64 and a half client that you have because we can help them, especially 65, right? You might do some other things, 70 and a half, 72, these things that do, planning, Social Security, required minimum distributions, all this stuff. You know what you're doing there. Log these notes, take, the prescription costs, things that they have problems with, network issues, caregiving responsibility, all this stuff that could potentially happen. And just be an advocate for your clients, right? You don't have to be an expert, but just know the things that they should be asking and teach them, how to do it. And in best case scenario, set them up with a partner like Move Health to be able to manage these things for them. So what are some proactive workflows you could do? You could run a quarterly report for people 64 and a half. You could build a Medicare touch point, an email, right? To say, hey, you're turning 65. Here's some things you should do. If you're already working with Move Health, you say, hey, I have a partner here at Move Health. You're 64 and a half. We're going to sign you up, to have an engagement with them. We don't, it doesn't cost clients anything to work with us, right? Super easy. Document all these things, take notes, and just, again, really be an advocate and be a good steward of the clients you're working with. Lastly, here's some final tips, right? I've said it a few times. I'll say it again. You should collaborate with specialists. You don't have to know everything. There's a lot to it, right? I don't know how many slides there are here. I don't know, 40 something, but there's a lot to it, right? And I'm like, wham, bam, giving you all this information. And there's a lot to it. When you're implementing a healthcare strategy for a client, especially in Medicare, the costs are high. You've got to tie health insurance and Medicare planning to financial planning. It just goes hand in hand. We talk a lot about tax planning. There's some incredible tools from really great companies that do tax planning. There's incredible tools for estates and trusts and wills and things like that. There's a bunch of stuff, and financial advisors that are forward thinking, they're getting into that. Healthcare planning and Medicare planning should come to the forefront of your conversation with clients. If you're doing your job, if you are maintaining that fiduciary responsibility that we have, you're bringing health insurance and Medicare planning to the forefront. And lastly, we're in season, right? Like it's go time. So Medicare is now, like early fall, that October, November, that's when we're getting busy. We got opportunities to help people. We'd love to help you. Just think about it. Bring it into the forefront of your practice and find a partner that can do it. Collaborate with specialists. If you don't have anybody, come join us at Move Health. Check out our system, our platform, and what we do here, and we'd love to have you. So there we go. Session number 3. What you need to know about Medicare is complete. Thank you so much for attending. Thank you so much for being here. Incredible questions. We have one more session to go. It starts in 18 minutes. It starts at 2:30 p.m. Central, 3:30 Eastern. We've got about 15, 16 minutes before the next session is how to fit open enrollment and healthcare planning into your service calendar. And you're going to be hearing from Cole Craven, one of the founders here at Move Health. You're going to hear from 3 partners of ours. You're going to hear from Cliff and Jennifer and Judson. These are not Move Health people. These are financial advisors. These are people in your industry, peers, and how they're utilizing and putting healthcare planning into your service calendar. And I'm excited for this panel. I'm excited for you to hear from them and learn from them. And we invite you back in just over 15 minutes. You have the link. If you don't, you can find it on our calendar. You can find it, or you can find it on our website. But please come and join us for the last session, how to fit open enrollment and healthcare planning into your service calendar. Thank you for attending. We look forward to seeing you again really soon. Thanks, everybody. See you in a bit.